Hello, I'm Dr. Sharif Mohammed. Today we're diving into something that affects millions and millions of families, but often, it doesn't quite make the headlines. We're talking about the hidden costs of getting sick. This is all about the money that comes directly out of your wallet for healthcare, and believe me, it has consequences that go way beyond just a doctor's bill.
So let me ask you this. What is the true cost of getting sick? It sounds like a simple enough question, right? But the answer, it's about so much more than a medical bill. It's about our savings, it's about our financial security, and it's even about the economic health of the entire country.
First things first, let's get on the same page. What exactly is out-of-pocket expenditure, or OOP as it's often called? Well, simply put, it's any payment you make directly for healthcare. This isn't money from insurance or from a government program. This is cash from your own pocket. To really see how this plays out, let's walk through a quick story.
Let's imagine a patient, and we'll just call them X. Now, X could be absolutely anyone. Your friend, a family member, it could even be one of us.
So imagine one day, X isn't feeling well and has to go to the hospital. This is a scenario we've probably all been through. But for X, this is exactly where that financial burden starts to build, little by little. Just think about all the costs that start piling up. X has to pay for the doctor's consultation, right? Then there are the medicines and any tests, say an X-ray or a blood test. But the expenses don't stop there, do they? You've got the cost of just getting to the hospital and back, and maybe even food while you're there. All of it adds up fast.
And here is the absolute key. Every single rupee for this comes directly from X's personal savings. Nothing is getting reimbursed later. This is exactly what we mean by out-of-pocket expenditure. It is the immediate personal price tag for getting medical care.
Okay, so that's the story for just one person. But what happens when you take this situation and you scale it up to a country of over 1 billion people? Just how big of a problem are we talking about here?
Well, the number it's staggering. In the year 2020-21, households across India spent a combined, get this, 3.28 lakh crore rupees directly on healthcare.
Now, to put that huge number in perspective, it made up 44.4% of all health spending in the country that year. That's nearly half of the whole pie, with the government and other sources covering the rest.
That spending was equal to 1.66% of India's entire gross domestic product. That's a massive chunk of the national economy paid for by individual people and their families.
Now, I should say, there is some good news here. By 2021-22, that share of out-of-pocket spending had actually dropped to 39.4%, and that's largely thanks to more public spending and better insurance coverage. It's definitely a step in the right direction, but the financial load on families is still incredibly high.
To really wrap our heads around this, let's zoom in a little and look at a specific region. We're going to take a closer look at the state of Kerala. And there's some more good news here. Kerala is actually pretty well known for having a strong public health system. And you know what? It shows. It does better than many other states, and people there generally pay less out of pocket compared to the national average. But, and this is a big but, the story isn't perfect. Even in a state like Kerala, families still face some pretty high out-of-pocket costs. And this is often because some of the most expensive parts of healthcare, things like specialized medicines, advanced diagnostic tests, or managing long-term illnesses, they often aren't fully covered by the public system. It just goes to show you how tough this problem is to crack. So, we've seen the cost to individuals, and we've seen the national numbers. Now, let's talk about the ripple effect. How does this personal financial burden actually end up affecting the entire country's economy? You see, when these costs get way too high, they can lead to something called catastrophic health expenditure. I mean, just imagine a financial earthquake that completely wipes out a family's savings. It can force them to borrow money or even sell their home or their land just to pay for treatment. It's a vicious cycle of debt and poverty that's so hard to escape. And this kicks off a really devastating chain reaction. It all starts with families under incredible financial stress. This, in turn, exposes the cracks in our public health system. And when people are sick and also worried sick about money, they just can't be as productive at work. And that ultimately puts the brakes on the entire economy.
So the big question is, what's causing this problem, and what on earth can we do about it? How can we start to reduce this enormous financial burden?
Well, there are a few key things driving this. For one, there's a heavy reliance on private healthcare, which is often more expensive. Then you have the high cost of medicines. On top of that, a lot of insurance plans don't even cover regular doctor visits. You add all that to the growing number of chronic and infectious diseases, and you've got a perfect storm for rising costs.
But the good news is, we actually know how to fix this.
To counter that reliance on expensive private care, we can strengthen our primary healthcare centers. You know, the first place we all go when we're sick. To fight those high medicine prices, we can work to make essential medicines free. And to lessen the impact of diseases in the first place, we can invest more in prevention. These aren't just pie-in-the-sky ideas. These are proven, effective strategies.
At the end of the day, it really all boils down to this. Bringing down these out-of-pocket costs isn't just a healthcare issue. It's about protecting families. It's about building a stronger health system. And it's about creating a much more stable economy for every single one of us.
So we're left with this one crucial question to think about. How do we build a health system that not only heals us when we're sick, but also protects our financial future? It's a massive challenge for sure, but it's one we absolutely have to solve. Thank you for joining me.